everyone, and welcome back to the Med Mic, where I talk to inspiring people in healthcare to learn about their journeys, challenges, and any advice they might have for any young people who want to be like them one day. Today's episode is very special because I'm joined by a very exciting guest. A board-certified neurosurgeon from St. Louis University, now retired from neurosurgery practice, named amongst the best doctors in America. Today's guest has worked in East Africa to help with neurosurgery and to improve neurosurgical care in East Africa. Let's give it up for Dr. Paul Young.
Thank you, Aisha. That's very sweet.
Yes, of course. So first, I just want to say thank you so much for taking the time out of your day to be here. I'm really, really excited to have you as today's guest.
Well, it's my privilege, as a practitioner of neurosurgery for many years and now retired. It's interactions like these that now are my passion. So thank you for the invitation.
Of course. So I guess we'll just jump right in. So could you tell us about yourself, how you got here, and just how really you became a neurosurgeon?
Certainly. Well, I'm a St. Louis native, born and raised, St. Louis U High, St. Louis U Med School. After med school, I decided that neurosurgery was the specialty that I really wanted to pursue. I'd always had an interest in the brain. And back then, that was the discipline in medicine that really seemed to attract me the most. So after med school, I did my residency and then in neurosurgery. And then I decided that I wanted to kind of pursue advanced training. So I spent a year in Switzerland with a gentleman by the name of Professor Ghazi Yassergil, who is, he's sort of known as the godfather of modern neurosurgery, somebody who developed a lot of the equipment and techniques. And then I came back and sort of began to practice neurosurgery with an emphasis on teaching. So I've always been involved in educational activities, focused primarily in St. Louis, although I have spent a year or two in other parts of the country. And now that I'm retired, as I say, teaching is what I do with a vast majority of my time. So
yeah,
that's me.
All right. That's great. So altogether, how long have you been in neurosurgery?
Well, let's see. I started my residency in 1976, and I retired almost 3 years ago, and I'm still teaching. So I think you could say 76 till the present and counting.
Wow. That is a lot of neurosurgery experience.
Yeah.
Yeah. Would you say that there's maybe like a certain, after, all that experience in neurosurgery, is there a certain procedure that you found that you're especially good at, especially exceptional at?
Well, my specialty was micro neurosurgery, which was doing procedures using an operating microscope. So that particular technique was developed by Professor Gassergill, who I studied with many years ago. And the applications were mainly to neurosurgical procedures on the brain. So, for example, treating tumors or treating strokes or really any type of surgical procedure on the brain. For the most part, you would refine it by using the microscope. Then it became applicable to spine surgery. So any kind of neck or really anywhere in the spine, lower back spine procedure, again, was done with the microscope. So if I had to say my uniqueness, if there was one, was just using that for virtually all of my operative procedures.
Wow. So this was like an emerging new technology as you were working as a neurosurgeon. How was it?
Yeah, back when I did my training, it certainly was. Now it's commonplace, and I would doubt there's any neurosurgeon doing any kind of procedure who doesn't very often use the microscope to do it.
Wow. So for like med school and all that, I'm sure you had to maintain a high GPA and do well in the MCAT and all that. So how was that? What was that like for you?
Well, the challenges really are getting into med school. It's really very competitive. So maintaining a reasonably good GPA in college and trying to do a wide spectrum of classes. So not just focusing on all the pre-med sciences, but getting exposure in everything. I think sets you on the right track. But once you're in med school, there really isn't. I never felt the same level of competition. I think you're doing what you're interested in, and so you're going to study hard. You realize the effort it took to get there. And so those 4 years are really spent learning as much as you can and figuring out what you want to do with the rest of your life. I don't know that I would tell you that you need to be at the top of your class to get into any particular specialty. I think all specialties across the board are open to virtually anyone who goes through med school and shows a particular interest. And a lot of that decision making as to who gets accepted where after med school is based on the chairman of a particular department. So, and if he takes a liking to you, you could be last man ranked in your class, and if he happens to like you, he's going to take you. So I think the real competition is in college and not med school.
I didn't know that that's how getting into a specialty worked. That's really interesting. So I mean, given that that's how med school works, would you say that it's changed at all? Do you think that med school now is any different? Getting into med school now is any different compared to when you got into med school?
Yeah, I think there are differences. I think now there's a lot of emphasis. I mentioned a little bit earlier on, taking a wide variety of classes in college. They would love to see somebody who's, taken all kinds of stuff and done well, rather than someone who's done well just in the pre-med science courses. They like to see people who have done volunteer work, who have reached outside and getting involved in things. And there's more and more emphasis on candidates who have taken a gap year, who have just taken a year and worked in healthcare, maybe continued their education, maybe gotten a master's degree somewhere, but they like somebody who's really shown that they can make it in the field of medicine by working in medicine. So I think those are all new additions to what medical schools are looking for in applicants.
Okay, well, let's talk more about you. So for you, what did the average day look like for you in training? Yeah,
great question. Back when I trained, there were no limits to the number of hours that a trainee could work. So there were many, many weeks that literally I was off for the entire week, maybe 30 hours for the whole week. Wow. The rest of the time I was in the hospital working. There was a situation actually where I remember vividly. I was operating between midnight and 6 a.m. for 21 days in a row.
Oh my gosh.
So it was excessive. It was in some ways crazy. I mean, many of my contemporaries fell asleep while they were in the OR or fell asleep driving home because, you were always tired. That's all changed. So now there are very strict limits that are imposed nationally on how many hours a resident can work. So that the work schedules are much, much, much more controlled and regulated than it was when I trained.
Yeah, and I think that's really for the better because I feel like you don't do your best learning when you're not in the right mental state.
Yeah, it's not possible, and it's not healthy. It's not good for you. And it's not good for your patients if you're falling asleep while you're in the operating room. So there are many bad things about it, and certainly. The controls were needed and make it a lot more sensible.
Yeah. Well, speaking of control, how did you maintain, how did you control your work and your life? How did you maintain a work-life balance during that time period? And how did you do that as a surgeon as well?
I'm telling you, that can be extremely difficult. And of course, that's why, if you're married, divorce rates are incredibly high during those periods of time, because it's very difficult to maintain any kind of balance. I think you have to have a family setting. You have to have a spouse who recognizes the situation back then, who was patient and knew that this would end in a few years and things would be better. And I mean, you're trying not just to stay awake at home, but, there are also there are study demands, constantly. There's new things that you have to read. There's something you hadn't heard about that is in the operating room tomorrow and you need to know about. I mean, so it was extremely challenging. And I'm sure that's another reason that, regulations and rules were put into place to salvage at least some kind of balance socially for people who are training.
Yeah. I think that neurosurgery especially is really something that requires your full attention, and sometimes, unfortunately, your time outside of work and outside of the OR and all that. Yeah.
Yeah, I mean, it's not just true of neurosurgery. There are many specialties back then. Cardiovascular, heart surgery was similar. So there were quite a few that really had incredible demands. And again, it's so much better now that they put limits on that.
Yeah. Yep. So I'm sure you've done plenty of operations in your life, but could you, I totally understand because I'm asking a lot here, but do you think you can think back to your very first operation?
Well, so the way training works is that when you first start, so now neurosurgery training is a 6 or 7 year apprenticeship. When I did it, it was 6. And from day one of year one, I mean, you are in the OR operating. Now, you're operating under the guidance of, a fully trained surgeon, your department chairman or someone else, and you're probably only doing very minor parts of the procedure or doing some kind of very simple procedure. So in that context, I would say that probably repairing a child's congenital meningomyelocele, which is a deformation of the lower back, or putting in a shunt in a child where you're putting a small tube into a dilated fluid space in the brain. Those were probably my very first operative procedures. Again, likely with someone standing there, giving me information. Once you finish your training, then there's no one there anymore. You are officially on your own, but you're trained to do everything. So I can't recall exactly what that very first time was, but it probably wouldn't have made any difference since I felt very comfortable doing whatever it was. So that's kind of the way it works, where you're gradually allowed to do more and more complicated things completely by yourself.
Okay, which is good because in my head, I thought it was say you practice on a machine or something like that, and then you one day are just put in the OR and you're told, okay, get to work.
No, I mean, in fact, back when I trained, there were no simulations to train on. And in fact, there was no cadaver material, no lab where you could go and practice on, a cadaver. Now that's all changed, and of course you can do all of those things. You can practice in the lab setting on a cadaver and do whatever procedure you're trying to learn, or there are many simulated situations that have been created where you can do almost any surgery, in almost a model. So that's all new in the last 15 or 20 years.
Yeah. Okay. As a neurosurgeon yourself, what do you think makes a good neurosurgeon versus a great neurosurgeon?
Well, I think the same thing would apply to any physician, and that's what's in your heart. If you have that connection to somebody and you are responsive to the trust that they put in you, and you have, kept your skills at the highest level that you possibly can, you're going to be a great neurosurgeon, or a great anesthesiologist, or a great this or a great that, because each patient is unique to you, and you're putting your heart and soul into everything that you do. I think as you go down from great to good to average and down from there, most of the time it's either a loss of skill or it's a loss of that connection to an individual patient. Sometimes, unfortunately, other things begin to be more important. And when that happens, I think it just degrades, it takes away from the job that you do as a caregiver.
And as a neurosurgeon, because you see so many different cases, how do you maintain the empathy and connection that you have with each patient without, I'd hate to say, I don't want to say growing numb, but for lack of better words, how do you maintain that empathy?
Well, I think it's the same thing that you could apply to all of us. So, especially your generation has an intimate connection to social media. And, is there a day that goes by where you're not connected to some bad thing that's happening to some poor person somewhere in the world? It's a daily occurrence. So how do you maintain your empathy for people around the world who are in bad places? Sometimes, it happens so often we can become apathetic, right? We can just let that slip away. And I think that's part of being a great human being, is finding a way to continue that connection, to continue to feel things, even things that you might not be capable of fixing, but you can always be connected to it. You can always stop for a moment and pause and, quietly connect compassionately with feeling to what's happening, and in your own way, either spiritually, or if you're, in a situation to do something about it, you respond to it. But I don't see that, being a caregiver and dealing with patients day in and day out is any different than being a great human being. And that's something we should all be, right?
Yes, I agree. 110%. Yes. Is there anything that... Oh, I'm sorry. Hold on a second. Oh, yes, that's what I was going to say. Would you ever, would you give, if you could give a percentage to how much of neurosurgery is technical skill and how much is, really just critically thinking in the moment, what percentages would you give each of those categories?
I think they're both vitally important. I think if you're missing one or the other, you're not going to be able to do a good job. So, the technical capabilities are something that you have to work on. It's like practicing anything. You continue to have to hone your skills. When you finish your training, you can't stop. You got to constantly be learning new things and practicing things that you may not have done for a while. So it's emphasis on keeping your technique strong. And then the critical thinking part of that, I think some of it is inherent to certain people. I'm sure people who, they just have that. They just have that capability of kind of being on top of things all the time and reassessing. And, in some way it's that putting yourself into the great human existence of time, right? Where we learn from the past and we're critically planning for the future, and we're finding a way to learn on both ends of that coin. And I don't know, and sometimes that you can train that into people. Maybe we can. And maybe that's part of the weaning out process as you go through med school and advanced training. If you don't have that, maybe the process is one where you won't make it, So, but I think in the end, both of those are critically important for doing a good job and taking care of people.
Yeah. Have you, speaking of like technical skill and things like that, would you say that you maybe developed your own style of performing the surgery?
No question. I think everyone does. I think as you go through your training and then, begin to practice, and one of the important parts is that you're constantly reassessing yourself. You're constantly looking at the results of the things you've done, and people always say, well, was that a perfect surgery? No, I don't think I ever did a perfect surgery in my life. I mean, what does perfection mean? It doesn't mean that it didn't go extremely well and that the patient did but there's always something that you take away, that you might have done this a little quicker, or you might have anticipated this happening a little sooner, or whatever it be. So I think it's that constant reassessment, as you're doing everything, that keeps you moving forward, because you can apply this to each of us from our personality standpoint. If we're not growing, then we're probably in the process of deteriorating, right? Yeah. I mean, growth is part of what we should all be, and it applies to whatever we're doing in life. So being a surgeon, a brain surgeon, is no exception to that.
Yeah. Well, how did you balance the uncertainty and of dealing with something as delicate and sensitive as the brain and the spine with actually getting the job done?
That's an incredibly good question. I think first and foremost, as a surgeon, you live by the principle, at all costs, do no harm. If somebody walks into the hospital, it's my job for them to walk out of the hospital, no matter what else. So I think you take that to heart in your decision making. And then, your experience, your confidence in your skills, you always have to be willing, in a sense, to rely on that rather than some other innate factor. A lot of people would say, well, I'm relying on the family giving me permission. So if this fails, well, they gave me. No, that was never something that I felt justified doing anything. I had to justify it on the basis of balancing do no harm with, what is the reward, benefit, downside to things we do. And if that's not in our favor, then I'm not going to do it. If it is, based on my experience and skill, then I'm going to do it. But I'm putting the onus of that success or the onus of that failure on myself and not on some other innate factor, if that makes sense.
Yeah. I think a lot, as humans, we tend to kind of shove the blame onto some sort of external factor a lot of the time. And I think No, go ahead.
No, I think you're right.
Yeah. And I think that would be something that's, you really would have to get used to not doing. Yeah.
No question. I think you're absolutely correct.
Yeah. So as a neurosurgeon, what do you think is something that you wish people knew about neurosurgery, specifically patient interaction?
Oh, I don't know. I think patient interaction is something based totally on trust. Imagine yourself putting your life, your brain's life, into the hands of someone else completely. I mean, that is about as high level of trust as there probably exists, right? So I think that's something that you take to heart. It's something that you carry with you from the moment of that first interaction until whatever their problem was and its resolution. So, I see somebody in the office, I operate on them tomorrow. Every night, every day from that point on, they're somewhere in here, and I'm carrying that with me. And you just don't let go of it until whatever that problem was is resolved. So it's a very deep level of trust and connection that happens from the very first moment that, you interact with a patient.
Yeah. And that trust and connection obviously has some emotional weight, like what you just talked about, that, of course you're going to carry that with you. How do you like handle it, like whenever you're outside of the operating room?
Very good question again. I mean, I think you can do one of two things. You can either, when the bell rings at 4:00, go home and let somebody else handle it, or you take it with you. And I mean, I guess I was of the generation of physicians that it never left me. I just could not turn that over to somebody else. It wouldn't be much different than leaving town. If you have a vacation scheduled and I had operated on somebody and they weren't doing well, I mean, I was constantly in touch with whoever was covering for me as to what was going on and interjecting, my feelings about what we might do. And there were many times where I actually flew home from a vacation to handle something that came up because it was me. I was entrusted with their care, and I just could not. For me, I could not pass it on or let go of it until it was resolved. So, yeah.
Yeah. How? Oh, hold on a second. Oh, yes. Also, I just wanted to pause really quick to say the Zoom meeting might end soon. Would you be okay with like rejoining? Because it's going to kick us out soon. Would you be okay with rejoining, or do you have something else you need to get to? Like, are you good on time?
I'm okay.
Okay, so if it kicks us out, I'll be waiting here. I'll rejoin everything and we can continue.
Fine.
Okay. All right. Well, my next question is, after working with patients and, really interacting with them on like probably one of the deepest levels possible, because you're dealing with their life essentially, are there any unforgettable patient interactions that you can maybe think of right now that you'd be willing to share?
Oh man, that I get that asked a lot, and the problem I have is there are just so many. There's so many people that we didn't give them a chance to survive, and they did great. Others who were doing great and then didn't do so well. And it's just a lot of interactions that, are memorable to me in many, many ways. I think maybe a better answer to the question are patients who have a life-threatening condition, and one of those, for example, is an aneurysm. That's a weak spot in an artery that ruptures, and it can kill you when it ruptures, or it can cause all sorts of havoc. And our job in those settings is to try and fix it. Well, I don't think there's anything in medicine that is so dramatic in terms of the results of that particular surgery. So it's an operation where we put a little clip on the weak spot on the artery, and if you put that on exactly right, and it's like a 5-second manipulation once you've gotten to where it needs to go, if you get it on just right, the patient's cured. This life-threatening condition is completely cured for life. They're fine. If, on the other hand, it doesn't go on correctly, or something happens while you're doing it, they could die on the spot or be severely disabled. So I'm trying to think of anything in medicine as a whole that in a few seconds with a certain manipulation of your hand that you can take and change somebody's life so dramatically. Yeah. I mean, for me, that was always a kind of a memorable situation.
Yeah, I really think that neurosurgery is especially cool because, I mean, from what I've heard, a lot of the operations, like you mentioned, are pretty quick, and it's just so fascinating to see how, like, something so seemingly small can have, like, a detrimental, insane effect on the life of somebody.
Correct.
Yeah.
Correct.
Yeah. After, working with the brain so long and working with memory, do you think that it's maybe changed about how you think about your own memories?
I think from my standpoint, as I've gotten, older and now retired, I'm spending a lot more time trying to understand how the brain works in a lot of ways because, again, we understand so little about a lot of things that happen in the brain. It's still very much an unknown frontier. So trying to figure out a lot of that on my own has become kind of a nice post-retirement passion. And I think memory is one of those things, our memories of things that have happened to each of us in our lives. Sometimes you begin to rekindle some of those connections to memories, and all of a sudden the floodgates open and you remember a lot of things that may have happened at the same time. So it's very interesting how our emotional state is so tied into our memory state. Things that were emotionally charged, obviously we remember a lot better. We remember those permanently, and they're right on the edge of our memory all the time. But there's then connections between those memories and many other things that spread out from there. So it's a very fascinating topic, and one that I'm spending more and more time trying to fully understand.
Yeah, which is, I'm really glad you brought this up because my next question for you was going to be asking about how much of the brain we know about. And, well, I guess I can still ask it, but do you think we know enough about the brain? Like, obviously you said no, but I guess what I'm trying to ask is, do you think we know enough about the brain to be, like, performing, like, the operations and being so advanced in medicine compared to where we started? Do you think we know enough to be doing what we're doing, if that makes any sense at all?
No, I think those are probably two separate things. I mean, I think the knowledge that we have about the brain supports the things that we do. And as we know more, then we'll be able to do more. So, I don't think the fact that we still don't understand a lot of the brain processes at this point in time affects in any way the things that we do for the brain. I think, we have been, for a lot of psychological issues, very drug dependent for many years, right? I mean, if you have anxiety, you're taking a pill. If you have depression, you're taking a pill. If you have this, a pill. But as we understand more and more about some of those disorders and what causes them, and what we're finding out is this connections between different parts of the brain that aren't performing properly, and so the way you solve it and cure it is to establish more permanent connections. So, as we do that, then our procedures will evolve relative to what we know, and I hope that process continues.
Yeah. After stepping away from practicing neurosurgery, what is something you wish you could tell your younger self?
Very good question. Experience always makes us better, doesn't it?
Yes.
And we all wish we could go back and do that thing again. I think there are just, again, many, many things that I I probably would have done a little differently had I known what I know now. Maybe the first and foremost would be just taking more time. When I was studying to get into med school, I actually did college. I got my college degree in 3 years. So I was in such a hurry. I took a summer and, I ran through college so that I could get to med school. I wouldn't do that. I think we need to take time in our lives to just, I don't know, become a sponge for everything that's happening around us. And, sometimes if we isolate ourselves from our own personal development, it's something that may not serve us well in the future. So I think slowing down and just taking more time probably would have been one of the major things I would have done differently.
Yeah, I feel like in humans in general, and especially in today's day and age, everyone's always so quick, just you want to run through everything and you forget to slow down, relax, just take in the moment. Yeah.
Absolutely right.
Yeah.
100%.
Yeah. This is actually a question that I told my last guest basically to give me a question to ask my next guest, and they were basically asking about do you think that as a medical professional how you use social media and how you use it specifically for personal expression should be managed or limited?
I think social media is an incredibly poor way to express yourself, my opinion. I think if there's a setting where it's the only way to express yourself, and there may be some of those, okay. But most of the time, a full expression of oneself is both a cognitive expression, right, and an emotional expression. Does an emoji express your emotions truly?
No.
It is such a poor way. So I don't know. I just don't think social media is a great way for any of us to express ourselves to another person. I think sometimes it's an outlet that is far too easy, and so you just rush off and do it, and maybe say things that you never would have said in ways you never would have dreamt to say, and they don't really represent truly how you feel when you can stop for a moment and think about it. And the other thing is interactions with people are such that so as you and I are talking now, my response and what I'm saying is somewhat dictated by my interpretation of how you're responding to it at that time. So it's a very dramatic and very almost collaborative give and take that's part of the human experience. Social media can never do that. So I'm not a big fan of that being a mechanism of any of us expressing ourselves well to other people. And I think many times, first of all, we're doing it in ways we shouldn't, and if we thought about it, we wouldn't. People blow up, say something, and then immediately take it down because they realize that's not what they meant, and that's not how they should have said it, I think social media is a great way to interact with many different things in this world. The capability of learning about people and interacting with in ways that you couldn't have even dreamed about just a few years ago. But for a communication, as a mechanism of interacting humanly with other people, it's not that good.
Yeah. I remember this was years ago, but there was this program that they had us watch in elementary school, and it was the same thing you said, an emoji does not really help you express how you feel, and I don't know, it really stuck with me, and I'm glad you're saying it again to really re-engrave it in my brain, because social media can be really something that's really compulsive and just so fast-paced you don't even think about it.
Absolutely.
Yeah. So we're kind of nearing the end. I only had a few more questions. But I just wanted to ask, is there something like after seeing all the things you've seen in neurosurgery, is there anything that you would tell a young person not to do?
Well, that's that's a little bit right up my alley. So, um, knowing a lot about the brain and its potential, um, there's no question that if any of us wants to be the best we can be, if any of us wants to, as a unique, never to be a born again human being, if we want to maximize that and realize that in our life, then it's completely related to the environment that we put ourselves in. I mean, that is the true nature of human free will. What is it, the environment that I am going to put myself in? And when we say put myself in, we really mean put our brain in, because it is going to cipher in whatever environment you put it in. And, we can talk about some of the current environments that I think are incredibly hazardous to brain development. And I mean, we can talk about addicting drugs till we're blue in the face, and everybody knows how bad they can be. But right now, cannabis is thought to be not that big a deal, right? It's legal, probably better than alcohol and nicotine, and go on from there. But the true facts are that in the adolescent, it's not safer than anything else. It is not a safe alternative because it stops brain development in the adolescent permanently sometimes. So, I think thinking about for all of us, especially when our brain is maximally developing as a child and an adolescent, thinking twice about what environment am I going to put myself in, and how might this environment affect me for the rest of my life? I think that's a very important question, and unfortunately, the parts of the brain. Sorry about that.
No, it's okay.
Parts of the brain that we're talking about, in terms of allowing us to make that determination, are the parts in an adolescent that aren't developed yet. So it's a no-win situation, and sometimes, but I think it's important, to always stop for a moment and consider what the alternatives are. What might happen in this situation? It's like you well know. I mean, you're at a party and somebody drove you, and that person's been drinking, and am I going to put myself in that car to go home? I mean, that's an environment that you shouldn't do, and that's many environments as we go through life.
Yeah.
Many.
Yeah. Okay, and my last question for you is actually for you to ask my next guest a question, kind of like what I just had for you. So if you could ask my next guest a question, what would it be? It might be a med student, a resident, or another doctor, but just any question.
All right. Well, I'm going to throw at the next person a philosophical question.
Okay.
That requires one to think. We now are pretty sure that the brain operates on a quantum level. And, in the quantum world, objects at distant locations from each other are connected in some fashion. So what I'm throwing out is, if the brain operates on that principle, if you come into contact on social media with some poor orphan in some distant country, it could be the Ukraine, it could be Iran right now, it could be Sudan, somewhere in the world where there's famine or war or destruction or death, and you just see a picture of this child, probably orphaned, maybe debilitated physically by war, and the look on that child's face is one of desperation and just terrible human misery. What's your response to that? Is your response to say to yourself, gosh, I'm glad that's not somebody in my family. I'm glad it's not my brother or sister or child or whatever. and just move on to something else? Or as a human being, a loving, caring, compassionate human being, do you make a connection? Do you stop for just a second or two or a minute even and feel something from deep inside your brain that's making a connection to that person? Well, we know that if you do that, if you make a connection, albeit probably brief, it is improving your plasticity. And when we say plasticity in the brain, we mean your capability of establishing connections between things. Your intellectual capabilities, your emotive capabilities are improved by those types of interactions. That's for sure. So it makes you better. My question philosophically is, do you think it does anything for that child? If the brain's operating on a quantum level, even if you're not making, as we can physically detail it, a connection, you're not talking or sending a message, or just the fact that you have emotively connected, does that make a difference for that child?
That's a great question. I'm really excited to hear the next person's response. This is one that you definitely have to stop and think about for a moment. I really like this one. Yeah. Well, to our listeners, I really hope that this conversation gave you a good behind-the-scenes look at what it takes to become a neurosurgeon, what it's like, and what Dr. Young's journey was like. And I hope it also pushed you to continue working towards your own goals. If you enjoyed this episode, don't forget to follow us on TikTok and Instagram so you won't miss any future conversations with any other healthcare professionals. And again, a special thank you, Dr. Young, again. And thank you for taking the time to join us, and we really appreciate it. Until next time, Med Mike.
Thank you, Aisha. Thanks, everybody.
Of course.
Bye-bye now.
Bye.